Hello and welcome. Today we're diving into a condition that affects many, but isn't always widely discussed: hypocitraturia. This is a medical term referring to abnormally low levels of citrate in the urine. Citrate plays a vital role in kidney health, and when it's deficient, it can lead to some serious complications. Let's explore what hypocitraturia is all about. So, what causes hypocitraturia? The causes can be quite varied. Dietary factors play a significant role. A diet low in fruits and vegetables, which are naturally rich in citrate precursors, can contribute. Another factor is chronic diarrhea or malabsorption, as these conditions can lead to loss of bicarbonate, a precursor to citrate in the body. Certain medications, like thiazide diuretics, can also reduce citrate excretion. And finally, specific underlying medical conditions, such as distal renal tubular acidosis, can significantly impact citrate levels. Now, let's understand the pathophysiology. Citrate is a crucial inhibitor of calcium salt crystallization in the kidneys. When citrate levels in the urine are low, this inhibitory effect diminishes. This creates a more favorable environment for the formation of kidney stones, particularly calcium oxalate and calcium phosphate stones. Citrate essentially binds to calcium in the urine, preventing it from combining with oxalate or phosphate to form crystals. Without enough citrate, these crystals can grow and aggregate, ultimately leading to the formation of troublesome kidney stones. In terms of epidemiology, hypocitraturia is fairly common, especially in individuals who have a history of kidney stones. It's estimated that it may be present in up to 60% of recurrent kidney stone formers. The prevalence can also vary based on geographic location, dietary habits, and the presence of underlying medical conditions. It's important to remember that not everyone with low citrate levels will develop kidney stones, but it certainly increases the risk. What are the signs and symptoms of hypocitraturia? Unfortunately, hypocitraturia itself doesn't usually cause any direct symptoms. However, the consequences of low citrate, like kidney stones, can be quite painful. Symptoms of kidney stones include severe flank pain that can radiate to the groin, blood in the urine, hematuria, nausea, vomiting, and frequent urination. If you experience these symptoms, it's essential to seek medical attention to determine the underlying cause. Diagnosing hypocitraturia involves a 24-hour urine collection. This test measures the amount of citrate excreted in the urine over a full day. Typically, a citrate level below 320 milligrams per day is considered indicative of hypocitraturia. The test may also measure other substances in the urine, such as calcium oxalate and phosphate, to provide a comprehensive assessment of kidney stone risk factors. While there aren't strict types of hypocitraturia in the same way as some diseases, it can be categorized based on the underlying cause. For example, you might have diet-related hypocitraturia, medication-induced hypocitraturia, or hypocitraturia secondary to renal tubular acidosis. Understanding the cause helps guide the most appropriate treatment strategy. Treatment and management of hypocitraturia primarily focus on increasing citrate levels in the urine. The most common approach is potassium citrate supplementation. This medication helps to raise urine citrate levels, inhibiting crystal formation. Dietary modifications, such as increasing fruit and vegetable intake, are also important. In some cases, addressing the underlying cause, such as managing renal tubular acidosis, may be necessary. Regular monitoring of urine citrate levels is crucial to ensure the treatment is effective. Preventing hypocitraturia involves a combination of dietary and lifestyle adjustments. Eating a balanced diet rich in vegetables, particularly citrus fruits, can help maintain healthy citrate levels. Staying well hydrated by drinking plenty of water throughout the day is also crucial for diluting urine and preventing crystal formation. Limiting sodium intake and avoiding excessive consumption of animal protein can also be beneficial. For individuals at high risk, such as those with a history of kidney stones, regular check-ups with a healthcare provider are essential for monitoring and early intervention. The prognosis for individuals with hypocitraturia is generally good, especially with appropriate treatment and management. By increasing urine citrate levels and addressing any underlying medical conditions, the risk of kidney stone formation can be significantly reduced. Ongoing research is exploring novel approaches to managing hypocitraturia, including the development of new medications and dietary strategies. Staying informed about the latest advancements in kidney stone prevention is key for maintaining long-term kidney health. Thank you for joining us today, and we hope you found this overview of hypocitraturia helpful.